Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Thursday, June the 18th. Just an update on our schedule for the coming few days. Tomorrow, Friday, we'll be releasing a written statement with information about COVID-19 for Friday, including case counts and other pertinent information. On Monday, we'll be providing a briefing at 3 o'clock, a regular briefing, and we've moved the briefing on modeling until Tuesday, so that will be Tuesday, the presentation on modeling. So we'll be doing that presentation in person, obviously, as well. We're honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh, and it's my honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So today we have 8 additional people who have tested positive for COVID-19 in British Columbia, bringing our total to 2,783 people in BC, and that includes 950 people in the Vancouver Coastal Health Area, 1,441 in the Fraser Health Area, 130 people in the Vancouver Island Health Region, 197 people in the Interior Health Region, and 65 people in the Northern Health Region. We have no new healthcare-related outbreaks, leaving us with 7 active outbreaks right now, 6 of which are in long-term care and 1 in acute care. Additionally, we have 588 people associated with our acute care or long-term care outbreaks. That includes 365 residents and 223 staff. There are no new community outbreaks, and we have 1 additional outbreak that has now been declared over. That's the one that was at Nature's Touch facility. So that's good news. And we continue to monitor and support the other 3 remaining locations where we have community outbreaks. I do want to say that one of our new cases reported today is an adult who is connected with an independent school in the Fraser Health Region. Public health teams have investigated and they are continuing that investigation, but a small number of close contacts have been notified, and no children have been involved. And as a precaution, the school has stopped their in-class learning for the balance of the year. Given that we still have spread of COVID-19 in our communities, this is not surprising, and it is something that we were preparing for and monitoring as children went and teachers and educators went back to in-classroom schooling at the beginning of the month. So we now have 190 active cases in the province, of whom we have 10 people in hospital, 5 of whom are in critical care or ICU. Again, today we have no new deaths of COVID-19, and 2,425 people have now fully recovered from the disease. As you're aware, yesterday we reported a new outbreak at the Mission Memorial Hospital and a related one at the Tabor Home long-term care facility in Abbotsford. And so those 2 facilities, along with the one announced the day before, the Maple Hill long-term care facility, are all linked, and we now have a public health team from Fraser Health who are working actively in all 3 sites to ensure that a detailed investigation has begun and that all of the appropriate measures have been taken to contain any possibility of spread. We are monitoring it very closely, and they continue to have an on-site team to ensure that we have all of the infection prevention and control measures in place and that testing and screening is being done at all 3 facilities. As these new healthcare outbreaks demonstrate, this virus can quickly spread and often undetected, and that is the challenge that we face, is that we can have very mild illness or early on in the illness or just before symptoms start. People may not know that they are infectious to others, and this can lead to multiple cases in multiple locations very quickly until it's recognized. This is a challenge that we will continue to face for the foreseeable future. We have done an amazing job here in British Columbia of bending our curve, but we have not yet, and nor is it likely that we'll be able to eliminate the virus completely from our communities in the near term. I've said this before, and it continues to be incredibly important for all of us, whether at home, at a family event, at work, at school. We must continue our vigilance, and we must continue to monitor ourselves for even mild symptoms, and always, always stay home, stay away from others, stay home from work, stay home from school. Even if you are an essential worker, stay home if you are even mildly ill right now. And get tested. You can be tested anywhere in the province. You can call 811 and you can have, and they will direct you on where you can get that done. We also know, and these recent outbreaks highlight to us, that our seniors and our elders are the most vulnerable to serious illness from COVID-19. And we know that here in BC and around the world. And this is why the precautions that we have in place in long-term care facilities, where we know the conditions are such that if the virus gets into those settings, it can spread undetected very rapidly, and that has led to so much of the tragedy that we have seen with deaths from this virus. We understand that the restrictions on visitors in particular comes at a very high cost, both for the residents and for their families and loved ones. We know how hard this is. Every person who enters a facility increases the likelihood that this virus may enter with them, regardless of the safety precautions that are taken, and we need to take that into account. It is really the terrible challenge that we are facing right now, and that is why it is so important that we continue our vigilance in the community to reduce the risk of this virus as much as we possibly can. Our approach has and will be to move forward slowly with caution, and we do believe that, like many parts of our economy and our province, we will be able to modify our approach and ease those restrictions on visitors and on people going in to support our elders and seniors when it is safe to do so. So whether at work, out shopping, out visiting a friend, using all of the layers of protections that we've learned is the best approach and the approach that we need to continue to take. So that means maintaining our safe physical distance from others, fewer faces and bigger spaces so that we don't give this virus a chance to spread. Using barriers, those are very effective in those places where we do need to get closer to others. Having clear policies for employees around making sure that we're not sharing space together in lunchrooms, in other parts of our work settings. And as a last measure, of course, using a non-medical mask for those times when we can't always consistently maintain our safe distances. Along with the other things that we also know, things like cleaning our hands regularly, cleaning our spaces, and keeping our bubbles small. Our strength and our safety is in using these multiple layers to keep COVID-19 low and slow and reduce its impact on our families, our communities, and our loved ones. To do that, let's continue to work together, to take care of each other, and each of us do our part. And we need to continue to do it in the spirit that we have for the last few months. Do it in the spirit of kindness and calm, and let's all be safe.
Thank you very much, Dr. Henry, and wanted to first of all say, obviously, how gratified we are, how gratified I am, how gratified everyone is that no one has passed away in the last 24 hours from COVID-19 in BC. In fact, only one person in the last 12 days has passed away, which I think, again, reflects the approach that Dr. Henry has taken, that Provincial Health, the leadership of Provincial Health, including and especially Deputy Minister Steve Brown, have taken, which is to say that everybody matters and that we need to be all in this together, from people at the Deputy Minister of Health level to citizens around BC who have made this possible. We're now at 10 people in acute care hospitals in BC with COVID-19. That's down from a high of 149, and it's down from yesterday as well. I want to say that people continue to return to use the healthcare system in ways that they did prior to COVID-19. Yesterday, we had 5,577 emergency room visits, and that in the Vancouver Island Health Authority, those visits were above pre-COVID levels to show the return to the system that people are making. And I think that's very significant and reflects, I think, the confidence people have and should have in receiving healthcare services, whether it's for COVID-19 or for anything else. I'm going to be just presenting two reports today, which I regularly do on Thursday. Both of them indicate the same thing, I think. The extraordinary work done by healthcare workers, members of the Hospital Employees Union, members of the Health Sciences Association of the BCNU, the doctors of BC, the ambulance paramedics of BC, unions such as the BCGU and others in healthcare, because these achievements are collective achievements, and they reflect, I think, the extraordinary commitment to one another that people in healthcare, whatever their role and wherever they're from, employer, employee, wherever they've been, have shown. The first report is on the single site staffing initiative, which is something that has been led, first of all, by provincial health officers and health authority chief medical officers of health, and by people across the system. And I'm pleased to announce today that all 501 sites, or 100% of sites across all health authorities, have now implemented single site staffing. All 8,878 employees who previously worked at multiple sites are now assigned to a single site. The final count of 501 sites has been verified and confirmed by the health authorities and the Provincial Health Office. The Ministry of Health, in collaboration with the Health Employers Association of BC, health authorities, and other partners, have developed a wage leveling guide and a funding template for facility operators. As well, we have determined the process to disperse funding to health authorities through to employers and methods by which we'll monitor the commitments and expenditures. Facilities are currently completing their data to submit to the health authorities so funding can start to flow. Individual wage increases will be retroactive to the date the site was placed under a single site staffing order. I initially estimated the cost of implementing all the single site plans and wage leveling at $10 million per month. Now that the transition is complete and more data are known, I'll be in a position to provide you with an update on cost figures in the weeks ahead. We have a working group of representatives from the Ministry of Health, the HEA-BC, and health authorities to ensure consistent provincial processes and data related to the single site staffing initiative. I just want to emphasize two things. One, other jurisdictions and others have understood, I think now, the importance of what we're trying to do and what the Provincial Health Officer wanted to do and what we in the Ministry of Health wanted to do with the single site order, supported by everybody, by the unions that I have already mentioned, by the BC care providers, by the Denominational Health Association, by the Health Employers of British Columbia, and led by our extraordinary team under Stephen Brown at the Ministry of Health. This is important. It's important to do the work, not just make announcements, do the work, and people have done the work. And our health system and our residents and our seniors and our workers are better for it. And I am very, very proud of all of them. I wanted to bring you up to date on surgical information, as I do every Thursday. Wanted to note here too the extraordinary work by people in the healthcare system to respond to some of, I think, the most challenging demands and requirements that we could possibly make. When we announced the surgical plan with the Premier and with Dr. Henry on May the 7th, we said our expectation was that the health system would be back to full capacity in surgeries by the middle of June. And I'm happy to report that we are there. In the week from June 8th to June 14th, 6,291 surgeries in that week were completed in British Columbia. 4,955 of them were scheduled surgeries, sometimes known as elective surgeries, and 1,336 of them were unscheduled. Just to put this in context, in the week of April 6th to 12th, there were 972 scheduled surgeries and 1,104 unscheduled surgeries for a total of 2,076. 6,000 surgeries is roughly what we do, what the health system does in a normal week in British Columbia, and represents, I believe, under the circumstances, with COVID-19 still around us and the fact that we had to ramp up again, an extraordinary achievement by healthcare workers and by healthcare professionals in our province, and I salute them today. In particular, I wanted to note as well that we are continuing to contact patients. And this is interesting because I think obviously people, and we saw this in emergency room numbers, had concern returning to the healthcare system in this time. Note that we've made 42,000 patient contacts to date since May 7th when we started contacting patients again for scheduled surgeries. And of those, only 1,090 were unavailable patients for COVID-related reasons. They had concerns, so that's a portion. And of course, they will continue to be served and be able to access wait lists as they become more comfortable for whatever reason. And approximately 1,867 were unavailable patients for other reasons. Approximately 2,933, exactly 2,933 patients have been removed from wait lists either because of duplication or for other reasons. So a huge effort by administrative staff, a huge effort by surgical staff, and the results are there to be seen. All 8 of our, in our public system, of our private sites, are operating right now at their full contracted capacity. That includes the Falls Creek Surgical Centre, which rejoined our team in public health care in the middle of March. In closing today, I want to comment on the power our actions are having in changing our BC future. 3 months ago, we surpassed 100 cases of COVID-19 in BC. The same week, we declared a public health emergency in the province. At the time, I referenced Dr. Michael Ryan of the World Health Organization. Asked if COVID-19 was a pandemic, he said more important than the term was how we all respond. Do we fight, he said, or do we give up? 3 months later, I hope each of us knows that in BC, we chose to fight, that people in communities made tremendous sacrifices in every age group, in every household, in every community. We followed our own lead. We listened to Dr. Bonnie Henry and we followed our lead, and we made a difference. Our hard work and our sacrifice help us slow the spread of COVID-19 in BC. With COVID-19, there's no hiding in the crowd. There's no room for bending the rules. There's no room at all for inconsistency in using the skills that Dr. Henry and public health leaders have taught us. Because it's in those gaps, those momentary lapses in safe practice, those moments when we think we're okay to take a risk, that COVID-19 seizes upon to reestablish its grip. I'd ask everyone to consider how much our individual response to COVID-19 continues to matter, today and every day in BC. At a time when when some may drift from their duty, I would ask each of us to stay 100% all in on our BC COVID-19 response, to bend the curve, not the rules, to stay 100% committed to using the skills Dr. Henry has taught us to stop the spread. Je vais dire quelques mots en français. Aujourd'hui, nous annonçons 8 nouveaux cas qui ont testé positifs pour COVID-19, pour un total de 2783 cas en Colombie-Britannique. Il n'y a eu aucun nouveau décès lié au COVID-19 pour un total de 168 décès en Colombie-Britannique. Nous continuons à offrir nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 10 personnes sont actuellement hospitalisées, dont 5 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. À ce jour, 2425 personnes dont le test de dépistage de COVID-19 était positif sont maintenant rétablies. Thank you very much. Merci beaucoup. Happy to take your questions.
Thank you, Minister. And before we take questions, a few gentle reminders for the media on the phone. Please press *1 to line up for questions. Media will be limited to one question only, and please keep your phones unmuted. You will not be audible unless I call your name. And we begin today with Marcella Bernardo, News 1130. Marcella, go ahead, please.
Ask Dr. Henry, how concerned are you about today's Peace Arch park closure and whether you believe it should have happened a lot sooner, considering lots of people were I guess, skirting the rules and meeting up and hugging and possibly doing more in that park.
Yeah, so I was informed about the closure. It was, as you say, closed for public safety reasons. There was consultations with the community, and there was concerns about the numbers of people who were in and around the park, and challenges with people, I understand, putting up tents and things like that. So it was not closed because of COVID-19. It was closed because of concerns around numbers of people and issues in the community.
The next question is from Richard Zussman, Global News. Richard, go ahead, please.
I'm sorry to ask about this again, Dr. Henry, but just on the point of the park being closed, what do you suggest people do who are relying on this, on staying in touch with their loved ones? You say it wasn't connected to COVID-19, so does that mean there's no cases linked to potentially people meeting at that park? And can you explain sort of the details of why this is not COVID-19 related, the closure?
Yeah, so I was not the person. It was not done under public health. It was done in consultation with the community and by Parks and Ministry of the Environment. And I understand there was extensive discussions with a number of community members, including the Semiahmoo First Nation, which was being affected. I'm not aware of any cases that are related to contacts in the park. But we do know that the reason that people were going to the park was because of the restrictions on border crossings that were put in place because of the pandemic. So it is clearly related. The issues are related to COVID-19, but not specifically the risk of transmission. And I think, it's a very challenging time for many people. And some people were able to be in contact with at the park with their loved ones, but like the rest of us in the province, we need to find other ways of being able to contact our family and friends and our neighbors who live in Washington State and other parts of the world where we've had challenges.
The next question is from Brishti Basu, Victoria Buzz.
Hi, thanks for taking my question. So yesterday, Premier Horgan said that he expects the province to enter Phase 3 of the reopening plan by next week. Do you share this opinion and optimism? And also, is there a timeline yet for when we can see the results of the province-wide survey from last month? Thank you.
Yeah, sure. I am cautiously optimistic, and the events of the last few days have been challenging. We've had a hospital cluster that's been spread to 2 long-term care homes, and that's very concerning. So we continue to see spread in our communities. We continue to have new cases, primarily in the Lower Mainland, although we have had positive cases in the last couple of weeks, both in the interior and the north. So we're not at that point where we can let down our guard. We need to continue to have the important measures in place that keep us all safe, and we need to continue those measures as a foundation as we transition. And I have said this before, and I still believe it. We're gradually opening up different sectors, different areas in our in whether you call it Phase 2 or Phase 3, but we're moving in that direction, and we will continue to move in that direction as long as we have those foundational pieces in place that we've all learned and we all need to continue. So yes, I'm cautiously optimistic. We'll be continuing to move on as this guidance becomes available for different sectors, and certainly thinking about things like travel within BC and how we can do that safely and respectfully to the communities that we're going to. In terms of the survey, yes, it's being analyzed now. We had such a great response with almost 380,000 surveys. So as you can imagine, it takes a bit of time to clean the data. And we had some preliminary look at numbers and where geographically people were coming from just this week. And I expect within the next week to 10 days, we'll have some very early data. But with a database that big, big. It does take time for the analysis to be completed. And we will be, our plan is to come out with pieces of information as each specific question gets answered and share that in a public way with everybody. So hopefully within the next week we'll get some of the early data out to people.
Rob Buffum, CTV, Vancouver Island.
So, hi, Dr. Henry. Thanks for taking my question. My question relates to Beacon Hill Park, where there's a growing homeless encampment, and the city has allowed people to have their tents up for 24 hours a day during the pandemic. There's now sort of a debate in City Hall where one councillor has said is pushing to have that reduced to just tents down by 7 in the morning, and there's a growing petition to that effect. The mayor today said, those tents are up like that on the advice of people, specifically yourself. And she said the city's next move would be based largely on your advice. And I wonder what impact your advice what impact it might have. The fact that there were a lot of overdose deaths in Topaz Park, where there was a group of people living together in a tent-like city.
Yeah, I think these are very complex and challenging problems that we're all dealing with. I've not had direct conversations with the City of Victoria, though I know my colleagues from Island Health have been very much involved. And yes, we do believe that there are measures we need to have in place to support people for a whole variety of reasons who are homeless or underhoused. We know that the access to some of our shelter systems, for example, is limited right now because of the concern and the risk of people being together and transmitting COVID-19, amongst other things. So the Topaz Park was an attempt to put in place a situation that could be supported. And as we know, there was a lot of public safety challenges that arose in that situation. This is much smaller and I know is being more controlled. And we need to have in place those supports. So moving under the public safety order, the disencampment order for Topaz Park, most people who needed it were moved into more supportive, secure housing. And the focus needs to be on those wraparound services that give people what they need in those situations. And I know that there's a lot of work being done by Island Health in partnership with the City of Victoria and other communities and community groups to try and have those supports for people who are in the safe housing now, and also for the smaller number of people who are now in Beacon Hill Park.
The next question is from Kathy Tomlinson, Globe and Mail.
Ask about the opioid crisis, if I could. An investigation into workers' compensation that we published today found many cases with injured workers becoming addicted to opioids after being sent back to work too early, injured, still in pain. They took opioids to cope, and some died from overdoses or suicide. What, if anything, would you like to see done to fix this long-standing problem?
Yeah, so as you are well aware, I know, we've had a public health emergency around the overdose crises here in British Columbia since, for almost 5 years now. And this is one of the big issues that we have been working with WorkSafe BC on for some time. They have had a program to address some of these issues, both for workers as they get injured and to assist and support workers who have substance use disorders, in particular addiction to opioids. So that is something that we have been working on here in British Columbia for a number of years with some success. And much of it has to do with how can we support workers who are injured on the job to ensure that they get the care they need and that they don't end up being on high doses of opioids and run that risk. So these are very challenging problems, as we all know. There are many reasons why people take drugs. Some of them have to do with physical pain and are a side effect of having injuries at times in the past. So no easy solutions either, but this is certainly, and I read the report that you had this morning, and it's aligned with what we saw as some of the challenges a number of years ago here in BC too.
Thank you. We have Mary Griffin from Czech News next. Mary, go ahead, please.
much. Good afternoon, Dr. Henry. I was just looking for your reaction to the fact that Canada has passed that grim milestone today of more than 100,000 cases of COVID-19, and it's just based on the trajectory of cases. Is there a point where you could see us doubling those? I know that would be worst case scenario, but is that a projection potentially?
You know, it's always really hard when we see these numbers, and we know that each of those people who have been ill reflect the pain on their entire family, their community, and the thousands of people who have lost loved ones during this crisis over the last few months. And it really is the reason why we need to continue doing the things that we're doing, and do them carefully and thoughtfully, and do them in the safest possible way. We know that if we look, though, at the trajectories, the curves across the country, they are coming down, and that is a relief and good news for all of us. They're not coming down as fast in some parts of the country as others, and you know, we have done the work here in BC to keep our curve low, but many of us have family and friends in places like Toronto and Montreal, where it's still very much an everyday tragedy of the people who are getting sick and people who are dying there. So yes, I think we're on the right track here in Canada, but as we've said in the last few days, you know, we look around the world and it is still taking off in many countries. We are still not seeing that decreasing that we're seeing here in Canada, in many places in the US, and that is a concern. When this virus is anywhere, we are all at risk. So this is how important it is for us to continue to take those measures to be safe, to keep our families safe, and to keep our communities safe.
Ethan Sawyer, CBC.
Hey, Dr. Henry. I'm just wondering if you can provide any more details about the transmission you mentioned today at the school. Just wondering if you can clarify whether the adult involved was a teacher, support staff, or administrative staff. And I'm also wondering if or how this informs our mitigation strategy heading into the new school year in the fall. Also hoping to get a comment in French for this as well.
Sure. So this was an adult who was involved in several different roles, including teaching in the school, and had a number of adult contacts. There were no contacts that were of concern with children in the setting, and this is not unexpected. When we went into opening up the in-classroom schools at the beginning of June, we knew that public health, we were paying attention to this, and that it was very possible that somebody would bring the virus to the school setting with them. We know that it's less likely to be transmitted between children or from children to an adult, but we also know that adults can effectively transmit it to each other, even with mild symptoms. So, this is not unexpected, and it doesn't change our assessment of the risk. The risk is still very low. This was managed. It was recognized quickly. It was managed. The very small number of close contacts are now in isolation, and we'll be doing the very same thing over the summer and when the school year starts next year as well.
Oui, c'est juste pour dire que la personne en question a été impliquée dans l'école de plusieurs façons et il n'a pas eu beaucoup pas du tout de connexion avec des enfants, donc ça c'est important de dire, mais nous attendions à des cas, et je pense que le Dr. Henry a parlé spécifiquement de ça lors de le recommencement des classes en personne il y a maintenant quelques semaines, et je pense que ceci change en rien notre détermination de continuer de protéger des gens, mais de continuer aussi d'avoir un système d'éducation qui sert les intérêts des enfants et des gens qui travaillent dans le système. Donc, le risque demeure minimal, mais le risque existe. Et ce que démontre ce qu'on dit tout le temps, c'est que ce qu'on fait individuellement et collectivement, tout ça compte. en tous les cas. Donc, il faut continuer à travailler, mais je pense que cela démontre à la fois notre détermination de protéger des gens et aussi le risque d'humour existant dans la province.
We have Cleve Deanshaw, Times columnist, next. Cleve, go ahead, please.
Hi, Dr. Henry. Western Hockey League Commissioner Ron Robinson said today in a press conference the league will need minimum 50% fan capacity in its arenas for the 2020-21 season to be economically viable for them. 5 of those clubs are in BC and play in Victoria, Langley, Kelowna, Kamloops, and Prince George. Starting October 2nd, they've announced. The NHL has resources to go ahead without fans, but junior leagues do not. They are mainly gate-driven, and they say they cannot survive without fans in attendance, even if they will be socially distanced. What are the chances of that happening in the fall in light of, fans being allowed in the rugby games in New Zealand and also some European soccer leagues? And what is your response specifically to the WHL's revelation that it will need minimum 50% socially distanced capacity to make a go of their season?
Yeah, so to answer the last question, I haven't seen that, and I don't know the details of what their proposal was. I do absolutely recognize that there are many leagues, not just hockey, that are dependent on receipts at the gate to keep them going, and so that is a challenge that we're all facing. I can't say right now whether having fans in seats is something that will be possible in the fall. What I will tell you is I'm part of a WHO group that has been developing guidance around this, including guidance that's been used by the Bundesliga and other leagues around the world as they are looking at having fans in and how that could be done in a way that minimizes crowds and makes sure that there are ability for people to maintain a safe distance, etc. So those things are being looked at around the world, and we'll be looking at them, of course, here in Canada and in BC as well. I can't predict what we're going to be like in the fall, but it is hopeful that that might be an option at some point. There was one other point I was going to make, but I think I've forgotten it. Sorry. Sure.
They'll give you a chance. Just say, I think you're right. I think that a lot of the discussion of the NBA and the NHL and everything else ignores the fact that, as you say, most sports that depend on gate receipts are severely affected by the limits we have on gatherings right now, and there's certainly no clear idea of when such limits on gatherings would be lifted, as Dr. Henry has said on a number of occasions. But obviously, the impact of that on sports leagues like the WHL, on communities like Prince George and Victoria and Kamloops and Kelowna, and others across Western Canada and across the country is significant. But I think it's fair to say that we understand the impact of those limits on sports leagues, on arts groups, and on others, and that they're a real challenge. But I also would say, and continue to say, that the sacrifice people continue to have to make, not being able to visit family members in care, not being able to do all kinds of things that are normal. These are the realities of the times that we're in. We all know, if we're talking about sports around the world, the impact on transmission in some countries of sporting events, which has been well reported and well understood. So this is a real challenge for us. People in BC love the WHL, but I would say that the rules that we're talking about, which have to be applied fairly and to everybody, are there for the safety of everybody, and that's why we're continuing. It's not to ruin anybody's fun or anyone's particular organization or circumstance. They're there because we're in a world pandemic where there's no vaccine and no cure.
Nick Wells, Canadian Press. Go ahead, please.
I will just say I meant to just make a quick comment on New Zealand. And yes, New Zealand was allowing everything to go back to what it was pre-COVID because they were under the impression that they no longer had any active cases on the island. But as we know, that recently they've detected 2 people who've had active cases. So we'll see what happens there.
Cheryl Jan, CKPG. Could you go ahead, please? Cheryl, are you there? Moving on, we'll take Keith Baldry next. Keith?
Hi, thank you very much for taking my question. On the issue of access to long-term care homes, I know you're working towards a policy to have that occur eventually. The BC Care providers today put out a news release calling for that to happen, but said they need more resources are required to make the work, more staff, more PPE. Is it your view that more resources are not needed to open up visits? And also, if I could get your reaction to the Prime Minister's announcement today of a contact tracing app that's being developed.
Yeah. Absolutely. We do believe that more resources, and that is part of the complexity of the problem around visitors into long-term care. We need to have a secure source of PPE, and as you know, that was something that was a challenge for quite some time. We think we're getting there now. We also know that when we think about the average long-term care home in British Columbia, we're talking about 200 to 300 people. So that's an additional 200 to 300 people that we will be letting into these very fragile environments and very concerning environments. So we need to do it in a way that's measured, that's safe, that actually people need to be trained on how to appropriately use personal protective equipment. They need to have an ability so that they're not putting other people in that care home at risk. So all of that requires extra people, extra staff. And we need to make sure it's safe for the people in the home as well as the staff, as well as for the visitors coming in. You know, many of us are looking after people in long-term care home, or our loved one in long-term care home may be our parent, but it may also be our spouse, and people who are going in to visit are at risk as well. So all of those factors are what make it such a challenging and complex problem, and one that is really challenging for us all to deal with. And you know, where do we weigh the risks? And you know, with more people going into a facility, the risk of an outbreak goes up, and we know that. So it is a matter of balancing. In terms of the app, we've been watching around the world, and this is something we've had many discussions on in public health and across our health system. So it is a notification app. It's not something that actually helps us a whole lot with contact tracing. We know that the important part of contact tracing is having that conversation with a public health person who knows the right questions to ask and can tell you what you need to know. Where it can facilitate this type of a notification app is if people are in environments like crowds when other people have that app on their phone too. So there is a requirement that lots of people have to have it before it has any benefit, that it could provide some way of notification of telling people to contact public health, for example, if somebody does turn up positive. So I think there's probably a place for it. It's not an answer in and of itself. It's a piece, a tool that we might be able to use to assist in some cases. We are also looking at how can we use technology to support our really important case management and contact tracing, and things like some of the apps that we are using now to follow up with people, because we do what we call active daily follow-up of close contacts every day for the incubation period. And we can, for many people, that can be done very effectively using an app or a virtual way, allowing us to focus our person attention. So the public health people who are managing contacts to manage larger numbers and focus the attention on people who need that extra support, whether it's a place to safely self-isolate, whether they need food or medications or other supports to help them do that. So it's something that we'll be looking at how we fit into our whole program.
Just on the long-term care question, very early on, or in March in the pandemic, in partnership with the BC Care providers of Nominational Health, we provided resources in support of infection control, $10 million at that time. The single site initiative, which is significant, something that many called for, from the Hospital Employees Union to the BC Care providers to others, and other provinces have talked about and have moved towards, but we've completed now, was supported by resources from the province. So we have consistently intervened in a way to get things done, and part of the challenge on the visitor issue, which is obviously one that has been before us right from the beginning, right to when visits were limited. We understood that it had very serious consequences for people. We're looking at all the aspects of that because in general, in a long-term care home, if you know them well, for many people who know them well, people come in more or less freely depending on the long-term care plan, so it doesn't require much organization. And clearly, regardless of the solution and the rules that are laid out and the public health rules that are set forward, we're going to have to work together to make this work for everyone and to keep people safe. And that is a significant challenge. I might add that the long-term care challenge in terms of visitors is somewhat separate from the acute care challenge. I think that we're working obviously very closely on the long-term care challenge in terms of allowing visitors for people who are residents in long-term care. In acute care, I think that may take longer than in long-term care, but we're obviously looking at both challenges right now.
We have time for one more question this afternoon. For any reporters that didn't get to ask a question, there will be a statement released later today. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the Provincial Health Officer's orders, visit gov.bc.ca/PHO guidance. Last question today is from Cheryl Jan. Cheryl, go ahead, please. Cheryl, are you there?
Oops.
So I guess this wraps up our Q&A today. Thank you all for joining.
Thank you.